I am a native of Shreveport, Louisiana. I was born and raised here. I'm a product of the magnet school system here in Shreveport, and I'm a graduate of Caddo Magnet High School. I remained in the area after high school graduation, where I attended Centenary College, and I have a bachelor's of science in biology. I also stayed in the area to attend medical school at LSU Health Sciences Center here in Shreveport. And then after I graduated from medical school, I moved to Atlanta, Georgia, where I attended Emory University School of Medicine, where I did my internship and residency in pediatrics. When I completed my residency there, my husband and I and our young daughter at the time moved to Baton Rouge, Louisiana, where I practiced for 3 years. And then in 2007, we returned to my childhood home of Shreveport, and I have been in the practice of pediatrics since that time. When I was 3 years old at my birthday party, I got a baby doll and I got a doctor kit. And the story goes that I didn't want to open any more presents after I got those two things. And sometime after that, I started telling people, anybody who would listen really, that I was going to be a pediatrician when I grew up. And it's kind of fun because I am back in my hometown of Shreveport, and so I, in the course of my day or in the course of my practice, will see parents and grandparents who say, I remember when you used to tell people that you were going to be a pediatrician and you did it. And I really am living my childhood dream, but I do feel like it's more than that. I feel like it's a calling. So I'm a general pediatrician, and I really do truly love all of the aspects of pediatric care. I love babies. I love going to the nursery. I love being there when a baby's born or immediately in those moments after birth. And I think just the miracle of life is not lost on me. So I tend to be a pretty casual person. If you come to me and see me in my office, you'll usually see me in scrubs. And I do that because I like to be able to interact with my patients on their level. I like to get down on the floor with them. I like to play with them. And I try to be approachable for parents and for patients alike. I try to answer questions and educate my patients in the way that reaches them where they are, be that in verbal communication, with a phone call, or in written or typed communication, just depending on whatever it is that they need.